going to talk about the investigations for the diagnosis of diabetic ketoacidosis in pregnancy. So, in patients where we are investigating a patient suspected for DKA, what are the parameters that we will find deranged? So, very easy to understand that in a patient with diabetic ketoacidosis, definitely there will be diabetes. So, as we had discussed in the previous video, this is the lady with diabetes and her two long legs represent the number 11, that is lab glucose hyperglycemia, and the levels are more than equal to 11 millimoles per liter. But it is important to remember that even in patients with diabetes, if this criteria is not met, yet the patient can have DKA. It can also happen at lower glucose levels. So, though this 11 millimoles per liter is an important diagnostic criteria, it is not an absolute, and DKA can happen in diabetic patients at a lower lab glucose level. Now, after D, we have K. So, as we'd already discussed about the ketones, that is the ketones. So, in this patient, we will get positive serum and urine ketones. So, it's very easy to do a urine dip ketone test for a patient who is suspected to have DKA, because she will have positive serum or urine ketones. Now we come to acidosis. Now, in the previous slide, we had discussed about acidosis, that is this old lady who is 73 years old and riding a car that gives a mileage of less than 15. Now, so car is for bicarb, and since bicarb is univalent, millimoles per liter is equal to milliequivalents per liter. So there are two areas in the TOG article. One of it says that the investigations for DKA has to be low serum bicarb less than 15 milliequivalents per liter, and in another portion of the same article it's written less than 15 millimoles per liter. So let's not get confused. For univalent molecules, the millimoles and milliequivalents are the same. So whichever unit it is, the number to remember for bicarb is less than 15. And this old lady is 73 years old. That is the pH that we have to remember. Now, one important thing which is given in the TOG article, I have drawn this artistic background to represent the art, which is arterial. And when it is arterial pH, it has to be equal to or less than 7.3. But when we're talking about the venous, as we had discussed in the previous diagnostic section, then it was less than 7.3. So just remember, 73 and below has to be arterial, and less than 7.3 is the venous. So 7.3 is the value that we have to remember. So 73 years old lady in this artistic background represents the arterial pH of less than equal to 7.3. Now this lady, if we can see, she is standing in a gap, and this gap is supported by a calendar. This gap is nothing but the anion gap, which is more than 12. A calendar symbolizes 12 months, and she is at a distance more than the calendar, so it is more than 12, which is the anion gap. Now, two more interesting things we have to remember about the investigations for DKA is, now this lady is very, very fond of a bass. So she has a base deficit. Why base deficit? Because it's a case of acidosis. That means the bases have to be less. Wherever there is acidosis, the base goes down. And if you can see the four legs of this chair, then you can understand that the base deficit is more than equal to 4. Here the units is milliequivalents per liter. So it is more than equal to, that is 4. You can see it is 4. So 4 onwards is the base deficit. Base deficit has to be there. It has to be more because it is acidosis. When there is acid, the base is deficit. The more the deficit is, the more is the acidosis. And this pot stands nothing for potassium. So now she has gone for so much of jumping and running over the gap and playing notes. So now she wants to have some water. So she goes for this pot. Okay, so pot is nothing but potassium, okay, which she has kept elevated. You can see the pot is kept off the floor. So this lady who is diabetic and is very thirsty, because we all know there is polydipsia in diabetes, so she has come to have water from the pot, that is potassium, which has to be elevated, or at times it can also be falsely normal, but generally the potassium has to be elevated. So remember this elevated pot to remember potassium elevation, because we all know the action of insulin on potassium. So the story is this lady whose blood glucose is more than 11 millimoles per liter, which is very, very evident from her long legs, looking like 11, standing on a gap which is more than a calendar, that is the anion gap, more than 12, very fond of playing tones, ketones in the urine as well as in, or could be in the serum, positive ketones. She goes to meet her grandma who is 73 years old, and the arterial pH thus is 7.3 or less. And this grandma, she is poor, she is old, so she is driving a car which has a speed of less than 15. That is, the car stands for the bicarb, which is less than 15, either milliequivalents per liter or millimoles per liter. It means the same thing because bicarb is univalent. And after doing so much of stuff, this lady who is already diabetic, so she has polydipsia, so she goes to the pot and she has potassium, which is pot stands for potassium, which is kept on an elevated tripod. If you can see, that means potassium is mostly elevated or at times can be falsely normal, and she's very fond of bass and music and everything. So if we can see, this bass system is kept on the chair which has got 4 legs. That means the base deficit in this case, because it's acidosis, the deficit has to be more. The more the deficiency of base, the more is the acidosis, and vice versa. And since it is on a chair with 4 legs, so the base deficit is 4 or more milliequivalents per liter. So the story of a lady with diabetes going to her grandma, driving a car, playing tones, having water from the pot, and playing music on a chair is what is the diagnostic criteria which we will find in laboratory investigation for a patient with DKA in pregnancy. Thank you.